Let's meet our next guest presenter. Eric Consolazio is a connected health visionary who understands what it takes to build incredibly complex platforms that don't feel that way to the consumer. He leads a team that's revolutionizing the way patients and doctors and providers connect and communicate in a way that's personalized and very specific to their needs. He's inspiring people to own their own health with innovations you never thought you'd see in healthcare. Things like VR, things like social, gamification, all awesome stuff. Information Week recognized him as one of the top 10 innovators across 26 industries. Let's take a quick look at what these guys are doing.
It began with a technology giant and the S-Health platform. Together, with an innovative leader in health and wellness, they brought the world the Coach by Cigna app and put a virtual team of health experts in the palm of your hand. Cigna is again revolutionizing healthcare delivery by creating a brand new way for the world to connect for better health.
Please welcome Vice President, IT Customer Solutions and Innovations Group, Cigna, Eric Consolazio.
Thanks, John, for the opportunity to be here. And thank you, everyone. To all of you and to the folks who are watching and listening around the world, welcome to the future of healthcare. Healthcare, as you may have heard, is an ecosystem. Doctors treat you. Hospitals work with doctors to make you better. Employers and the government subsidize the care you receive. And in all of this, you need to get the best care for your money. Oversimplified, Cigna's role is to coordinate what goes on in the ecosystem to get you the best care for your money. We also manage a network of hundreds of thousands of medical professionals and operate in 30 countries. My job is to build and maintain the digital experience for our customers, and through innovation, improve both the ecosystem and people's lives for the better. The video you just saw gives you just a glimpse of how the healthcare system is changing, but the needs are age-old. They're the same for me and for you and for people around the world. What is needed? Affordable, accessible healthcare. Having the information to make important health decisions, to take control of our health and have the tools to care for the people we love, to be treated like a person and not a number, and to have a personalized experience, to make what is complicated easy and intuitive and engaging. The healthcare industry is changing, but in many ways it does not want to change. Market forces, regulation, and technology are driving that change. But only one of those, technology, can also enable the change. And that is why I'm here today. Because I believe many of the significant innovations for healthcare are not going to come from medical researchers or biochemists, but from the people in this room. You will envision and create the innovation for improving the health, well-being, and sense of security for people around the globe. At the center of this innovation will be the smartphone. Your phone is actually becoming your personal healthcare connection, your primary care device, collecting personal data from devices around you and connected to you, taking information from multiple sources and analyzing them to give you immediate feedback. It will forward your information to your care team and provide real-time insights. Connect people to the best care virtually, improving access and reducing cost. It will allow sharing of information, real time, to manage the conditions of those you care for and those who will care for you. Your mobile device will be your coach, your trainer, your nudger, moving you in steps to better health. The creation of Coach by Cigna is an example how an app can be a digital health and wellness tool and serve as that coach, that trainer, that nudger. But this is going to become much more. It will also become your healthcare coordinator, your lab, and the first place you go when you need care. It will be your primary care device. We are already hurtling down that path. But right now, there are thousands of apps with separate destinations, managing disparate data, requiring each person to coordinate not only their care, but their apps, adding complexity and requiring them to re-enter and maintain redundant data across apps. On the verge of doing great good, we are making it more difficult for our customers by throwing technology uncoordinated at them. Apps as islands. Thousands of islands floating in the sea of healthcare. Our customers, our people, swimming from island to island. At Cigna, we've found that as the number of destinations go up, engagement actually goes down. Even a few extra clicks or taps can greatly affect initial and ongoing engagement. We've also found that this activity has to be connected to personal goals. Is it really my goal to walk 10,000 steps? Or is it to win a physical challenge against my friends? To get fit for my wedding? Lose a few pounds before I go on a speaking engagement? Grow gracefully old with the one I love most. It means that our goal as a developer community is not to connect technology, but connect people through technology. It means that as a developer community, that we cannot wear blinders. We must be aware of other innovation going on around us and complement it. So what should be our focus? The first is engaging the consumer. And that begins with mobile solutions that enable, for example, shopping for benefits via a simple app, virtual care anytime, anywhere, using wearable devices, and even games for chronic care management. This is the new reality of health and wellness, a reality that redefines the customer experience. As part of that, gamification has become an important way by which we engage our customers. Today, we're using gamification for health risk assessments, for enrollment applications, for disease management, and even to get our kids off the couch. Seriously, child obesity is a raging epidemic. Our latest role-playing game, called Adventure Life, encourages kids from 7 to 17 to become more active. Steps are used as currency to unlock challenges, buy items, level up. We're even experimenting with virtual reality for stress management. And who here doesn't need a little stress management? I know I do. We've developed an initial VR prototype. And initial tests have found that we can actually reduce brainwave activity with a person in the middle of a workday by taking a little time to decompress and escape into a world of guided meditation. We have both Adventure Life and the VR pod here, right outside the hall. So stop by and give them a try. Next, the social network. The social network also plays a role in engaging individuals in healthcare. We believe the ability to change behavior is significantly influenced by the social network. For example, consider the following. 41% of people surveyed said social media would affect their choice of a doctor or hospital. We believe that a person's social circle can be a big factor in nudging and reinforcing positive behavior change to improve health. Next on the list is adapting to and finding opportunities within regulations. Currently, there is a race in healthcare to move from what is called fee-for-service to pay-for-performance. In pay-for-performance, a doctor or hospital is incented for health outcomes rather than by the number of visits. In January of 2015, the CMS adopted the 50/90 policy, which states that by 2018, 90% of payments are going to be associated with some sort of quality program. And of that number, half will be reimbursement alternatives to fee-for-service. Maximizing outcomes, minimizing the cost is the goal. But what does that mean to you? Solutions that improve outcomes, make people recover faster, keep them from readmissions. Keeping them healthy will be more valued than ever. Solutions so that you can avoid the hospital, because apps are cheaper than hospital beds. The Internet of Things can be better than dragging a bunch of equipment with you down a hospital hallway. Connected mobile devices are changing the way we engage with consumers and defining a new healthcare ecosystem. We're now just beginning that journey where integrated innovation will drive improved affordability, higher satisfaction, and most importantly, better health outcomes. So let me wrap up with some thoughts and advice as one developer to another. One, use empathy in whatever you do. Know your customers by looking through their eyes and knowing their motivations, not yours. Two, healthcare is serious business. You're affecting people's lives. So whatever you do, you have to do with quality far beyond anything you've done before, because people's health is at stake. Three, you can make money in this business, but if you're in it just for the money, this industry is not for you. But if you're in and you do it right, you just might save someone's life. How many here like their job? I love my job. I believe I have one of the best jobs in the world. Why? Because if I do my job right, I have the ability to affect, for the better, the lives of literally millions of people. And so can you. You are the spark to ignite innovation. And I challenge you to use the talents that you have developed to apply and improve people's lives within healthcare. From Indiana to Indonesia, you can affect the lives of millions of people. And maybe, just maybe, together, we can change the world. So for you and everyone on every continent that is watching this, I challenge you to answer these questions. Are you ready to change the world? Are you ready to make history? If you want to make that journey and you want to walk down that road, I will see you there. Thank you all very much.
I don't know what that road is, that the name of that road that Eric's talking about, but it makes me think it's called Courage Avenue or something like that. I really salute him and his company, Cigna, for what they're doing. There's really no industry out there that's more important to every single human on earth, and that I think we all know is kind of messed up. I mean, it does amazing things, but it also gets mired in its own structure. And so to be an incumbent, to be an insurance company and be trying to use technology to change the actual thing that supports their existence, I think takes a tremendous amount of courage. And obviously he has that passion and that intensity in his blood. So thank you, Eric, for sharing that.